Good evening, Facebook community. This is Jennifer with Uplifting Life Naturally, hopping on here for a live broadcast in honor of Mental Health Awareness Month. As I mentioned yesterday, for those who caught my live broadcast, I am going to be doing some individual videos this week talking about some various topics related to mental health. I think it's a very important topic that we can all use a little further education and even some encouragement for those who may be suffering from some of these illnesses or have a family member or a child even who is suffering from such illness. For those who know me, I am a physician assistant and I currently do practice in behavioral medicine. I currently am providing behavioral health services to our veterans at a local VA clinic here in Johnstown, Pennsylvania. Short of some of the rules that come along with the Veterans Administration, I really find it rewarding taking care of our veterans. Being that I am in behavioral health, I see quite a wide range of disease processes from a mental health standpoint, but over the years have come to learn a lot about them. But along with that, I have seen the effects, the good and the bad, of treatment and lack thereof of treatment, if you would. So what I wanted to talk a little bit about tonight is depression. I'm just going to hit on a few possible signs and symptoms and what we can do about that. And I see I have a lot of people hopping on here. As I mentioned before, I am awful with my public speaking skills, so I'm trying to improve on this. So I apologize if I can't catch everybody's name. So I'm just going to be general. Thanks for hopping on. I always appreciate everyone's support. So getting back to our topic in regards to depression, one thing I really want to stress is depression, along with any other mental illness, oftentimes comes along with a stigma. In my opinion, I think that might be improving a little bit over time, and as more people are becoming aware or not worrying so much about what other people think and just doing what's best for themselves and their family, I think that stigma is maybe improving a little bit, but unfortunately there's still a big stigma out there in regards to any mental health. So I certainly want to stress the importance of not judging when it comes to somebody with depression. Depression does not discriminate, just like any mental health illness. It can affect any one of us. Working in behavioral health, as well as just even the general healthcare profession over the many years that I have been doing so, I have seen where depression has affected the young and the old. They've affected, all socioeconomic classes from poor to rich, and it just doesn't, decide, who it's going to affect. It can happen to anybody. It can happen to those from an intact home just as well as it can happen to somebody, from a broken home. So if you know of somebody struggling with depression, try to, offer them a little bit of support and encouragement. Try not to be judgmental. And if you're somebody who, has been fortunate to not, have experience with either yourself or a loved one suffering from depression, really consider yourself blessed, because there really is so much of it out there within the community. So as far as some signs and symptoms of depression, they do affect us both physically as well as from a behavioral standpoint. That's my daughter peeping in here, who is trying to avoid the camera but wants to see who all is hopping on. So apologize for that. So anyway, signs and symptoms, like I said, they can be physical in nature, they can be behavioral, they vary from person to person, and there's really no general exact symptoms for depression. I know a lot think that your textbook picture, if you would, of depression is somebody sitting around crying all the time. And while that certainly can be the case, that is not the only way that depression presents itself. People can present, like I said, with some sadness, loneliness, feelings of worthlessness or emptiness. Sometimes, and I notice this more in males, especially the younger population of males, they present more with anger and irritability. Depression can affect our sleep. Sometimes people sleep too little, they don't sleep at all. Sometimes they sleep too much. It also affects our appetite, again, from too little to too much. Let me see here. And Also another one that's pretty common is a lot of chronic aches and pains, which, I guess sometimes could be difficult. I know a lot of us struggle with that, and especially as we get older with the arthritis, but chronic aches and pains and muscle aches and such can also be a sign of some underlying depression. So if you or anyone you know seems to be struggling with these symptoms, please discuss it with your healthcare provider. Some of it could be from other sources or other health issues or other problems, but it certainly can be from depression as well. So especially if, somebody's really been struggling and the everyday type of things don't seem to be helping, certainly keep underlying depression in that possible diagnosis of, what they may be suffering from. As far as treatment for depression, that also is variable. It ranges from medication therapy to counseling services to even the alternative forms of medicine these days, something like yoga, essential oils, and even meditation. So some of those things I know easier said than done, but they, are, some simple ways that you can learn to take care of yourself. I know myself, I'm just currently starting to learn a little bit of yoga so I can help share and, get others to understand that practice as well as meditation. So even though as a physician assistant and my experience is with prescribing medicines, I find it very important to encourage, the non-traditional forms of treatment as well. So, start thinking of some of those things. If, this message is hitting home to you or someone those are some things you can do or try. Maybe if you can't get in to see your physician right away, or you or someone like myself who doesn't like to go to the physician and wants to try some things on your own. Certainly, however, if there are thoughts of suicide, recurrent thoughts of death, passive thoughts of death, somebody, really struggling with not wanting to be alive, that type of thing, by all means, take that seriously. Oftentimes, threats of suicide are a call for help. So if you would identify that or hear of that within your circle of friends, again, please take that seriously. It's always better to, have a situation looked into and find out that, maybe there really isn't something going on than to, have a tragedy occur. So if that does happen again, take that seriously. You can call 911, go to